Welcome to the University of Washington Tracheotomy Care Training video, module on managing bleeding from a trach. By the end of this video, we anticipate you will be able to list several risk factors for bleeding from a trach and how to avoid them, describe the initial management of bleeding from around a trach tube, and describe the initial management of bleeding from within a trach tube. Blood-tinged mucus is frequently seen immediately after tracheotomy placement or replacement. This can result from bleeding from the surgical site or from trauma or granulation tissue along the tracheotomy tract. Most of this bleeding resolves on its own and will be coughed up by the patient so it does not go down into their lungs. Other common causes of bleeding from a trach tube include suctioning. Aggressive suctioning can cause trauma to the tracheal walls and result in patients coughing up blood or sometimes blood clots. For this reason, as we described in the module dedicated to suctioning, we recommend suctioning be used with care and only when necessary to remove secretions that patients are not able to cough up on their own. Another way to prevent bleeding is by maintaining adequate moisture and hydration of the trachea. This is done by regular use of a humidified trach mask or with a heat and moisture exchanger, sometimes referred to as a nose or Swedish nose. The bleeding that occurs shortly after initial placement of a tracheotomy tube and sometimes after replacement can often be managed by placing a drain gauze around the trach site and replacing it as often as needed. This can sometimes be up to a few times an hour. When the bleeding is more significant, application of steady pressure for 5 to 15 minutes over an area that is oozing can be helpful in allowing a patient's natural clotting mechanism to stop the bleeding. If the bleeding continues, you should certainly contact a medical provider for assistance. If the bleeding is dripping into the breathing passageway and being coughed up continuously, this too can be a medical emergency. When small amounts of blood are coughed up through a trach tube, this is often managed expectantly with humidification and careful suctioning in the trach appliance only to avoid additional trauma to the tracheal wall. Remember that the source of the bleeding can also be above the level of the tracheotomy if blood is dripping down through the larynx or voice box. An example of this is a nosebleed, in which case stopping the bleeding at the level of the nose is critical for controlling the blood loss. Larger amounts of bleeding from within the tracheotomy tube may require procedures such as bronchoscopy to identify and control the source of the bleeding. This is discussed in greater detail in a module series dedicated to bronchoscopy. Occasionally, in a well-established tracheotomy, a new onset of bleeding can represent an important medical emergency. The tip of a long-standing tracheotomy tube can put undue pressure on the front wall of the trachea and eventually wear a hole into the wall. This space in front of the tracheal wall can contain a large artery branching off the aorta, called the innominate artery. A hole between the trachea and innominate artery caused by chronic pressure from the tip of the tube is called a tracheo-innominate fistula. Sometimes the presence of this fistula can be heralded by a small amount of bleeding called a sentinel bleed, which may soon be followed by a larger, immediately life-threatening episode of bleeding. Patients who are at home or in an outpatient setting should immediately be seen by a medical provider in these instances. In general, any new bleeding in an established tract should be examined with an endoscope through the trach tube to look for irritation, excoriation, or scabbing along the tracheal walls, especially the front or anterior tracheal wall where the innominate may lie, and the side walls where the carotid arteries may lie, particularly in patients who have had scarring from neck dissection or radiation therapy. In this module, we describe the management of bleeding from around and within a trach tube.